So welcome back. Today we'll be talking about another example of the endocrine gland, the thyroid. Now the thyroid itself is a word that comes from ancient Greek because the Greek soldiers would use a shield that was larger on the ends. And if you've ever seen the movie Troy with Brad Pitt, you'll see Achilles' shield just like that. Now the thyroid is about the size of a AA battery. It sits right in front of the trachea and it has two lobes. And when it gets bigger and bumpier, if it doesn't work right, is called a goiter, and it can press on the trachea and the esophagus behind it. Thyroid disease is a very, very common. And in fact, if you take that example of the how many people do you need in a room for one person to get thyroid disease, you only need about 50. And it was first described by the ancient Chinese doctors around 1600 BC, and they would give patients seaweed to help them swallow better since the thyroid was pressing on the esophagus. Now, the symptoms of thyroid really depends on the hormone level itself. If the thyroid is too low, then the patient gets constipation, they get tiredness, they gain weight, they get depression, memory issues, and other symptoms. If the thyroid is too high, then the opposite happens. The patient gets very jittery, they have diarrhea, they have dangerous weight loss, and they also will sometimes get memory issues, but they can get anxiety and irritability, and they have other problems. Now, regardless of whether the thyroid is low or high, both types of patients can get symptoms of their joints, skin, and hair. The way the thyroid works is it takes iodine from the blood and it puts it into the gland and makes thyroid hormone. And that thyroid hormone can make things faster in the body. The causes of thyroid disease are many, but the usual suspects are it can be genetics, it can run in families, but interestingly enough, sometimes viruses or other things can irritate the immune system and then the body can attack the thyroid. There are certain medications that can affect it, cancer, of course, and iodine deficiency, because again, the thyroid needs that iodine to make the hormones. But since the 1920s, iodine deficiency has not been as common, especially when it was introduced to table salt. Fun fact, those Chinese doctors that were giving seaweed to their patients, seaweed is very high in iodine. So inadvertently, they were actually curing the disease. The treatment for thyroid really depends on what the level is. So if it's low, it's very easy. You just replace the hormone and the patient feels better. If the thyroid hormone is too high, however, then special medications are needed, sometimes radioactive iodine to shrink the thyroid, sometimes even surgery to remove it. As far as diagnosis of thyroid disease, it's mostly blood tests, sometimes an ultrasound, sometimes a biopsy. The long-term prognosis of thyroid patients is very, very good. But as usual, the earlier you diagnose it and the earlier you treat it, the better. Because imagine this, if the thyroid hormone is too low, then the heart doesn't work as hard, it's sluggish, and blood doesn't get to the rest of the body. However, if the thyroid hormone is too high, now the heart is working too hard and gets exhausted quickly. And there are certain types of thyroid cancer that can spread very quickly and be very dangerous. But at the end, replacing the thyroid levels in a patient so that it feels normal really improves their quality of life. It makes them feel much better, short-term and long-term. As Jean-Luc Picard said, live now. Now never comes again. Until next time.